Hello everyone. So in today's video, we are going to talk about the shoulder joint. The shoulder joint is a simple ball and socket type of joint. So it's very important to remember that because a lot of students forget that it's a ball and socket, and that could risk you guys a lot of points if you don't know that. So remember, it's one of the most famous ball and socket type of joint that's found in the body. The articular head of the shoulder joint is the head of the humerus, while the articular fossa is the glenoid cavity of the scapula. Now, there is a capsule that surrounds the shoulder joint that goes from the neck of the scapula all the way to cover the head of the humerus as well as part of the tubercles of the humerus. And we also have a lot of ligaments around the shoulder joint. So let's explore those. What we have over here, the highlighted one, is the middle glenohumeral ligament. Now the glenohumeral ligament has three bands. It has the superior band, the middle band, and the inferior band. Now you can call those separately, either with their full name, so the superior glenohumeral ligament, middle glenohumeral ligament, or inferior glenohumeral ligament, or you can just call them as bands, superior, middle, and inferior bands of the glenohumeral ligament. Now, why is this ligament important? This is important to make sure that anterior dislocations don't happen. Um, let's explore the next one, the coraco-acromial ligament. So as the name entails, it starts from the coracoid process and it goes and attaches to the acromion of the scapula. Now, what is the importance of this? It's to make sure that the arm doesn't overextend. So if you imagine now you extending your arm, you wouldn't be able to extend any further than about 170 to 180 degrees, and that's happened because of the coraco-acromial ligament, as well as it's majorly a combination of that ligament as well as some of the muscles that are found around the shoulder joint area. The next ligament is the coracohumeral ligament, which goes from the coracoid process of the scapula and attaches to the tubercles of the humerus. And then we also have the transverse humeral ligament. Now, you can see that it's found on top of the intertubercular sulcus, and it wraps around the tendon of the long head of the biceps brachii. So we will talk a little bit more about the tendon of the biceps brachii in a minute. So, but for now, just remember that it's found on top of the tendon of the long head of the biceps brachii, in between the intertubercular sulcus. Okay, so that would be all in terms of the ligaments. So let's explore those names again. The glenohumeral ligament with the three bands, superior, middle, and inferior. The coraco-acromial ligament, the coraco-humeral ligament, and the transverse humeral ligament. Now, what we have left to talk about is the accessory features. Now, there are two accessory features. One is the tendon of the long head of the biceps brachii, and the other one would be the glenoid labrum or glenoid labrum. Now, what is this glenoid labrum? This is a cartilaginous margin which is found around the glenoid cavity. So now, what is the importance? Why would you need to have a glenoid labrum around the glenoid cavity? Now, you can appreciate, if you have already seen my video of the scapula, or if you have physically seen a scapula, is that the glenoid cavity has a very small concavity. So that would not be sufficient to make sure that the head of the humerus remains in place. So you can imagine now the head of the humerus will be quite wobbly and will be moving around the glenoid cavity. So we don't want that. We want the head of the humerus to be quite stabilized. And the glenoid labrum does just that. It arises from the glenoid cavity and it deepens the glenoid cavity. So that gives more room to make sure that the head of the humerus is stabilized and it remains in place. So that would be the function of the glenoid labrum. Now the other accessory feature is the tendon of the long-headed biceps brachii. So what this does, it makes sure that the head of the humerus remains attached to the scapula, to the glenoid cavity. So it provides traction. It makes sure that it strongly remains attached strongly to the glenoid cavity. So those are the two accessory features. Now let's talk a little bit about movements. So there are a few movements that are available around the shoulder joint, and those are flexion, also known as ventral flexion, extension, also known as dorsiflexion, adduction, which is the movement of the arm towards the body, abduction, which is the movement of the arm uh, outside of the body, and also external rotation and internal rotation of the arm. So now these are the movements around available around the shoulder joint. So that would be all in terms of bones, ligaments, capsule, the articular head, the articular fossa, accessory features as well. Now one thing left to talk about is muscles. The muscles that are found around the shoulder joint. So what we have around here is the trapezius, but that doesn't have any direct correlation to the shoulder joint. So we have something called the rotator cuff muscles, which are the ones that I'm going to mention right now. And I think for today's video, if you guys know the names of those muscles, the names of the rotator cuff muscles, that would be enough. I will talk about the rotator cuff muscles in more detail in another video in the future. So stay tuned to see that video. Now, there are 4 rotator cuff muscles, and those are the following: the supraspinatus, the infraspinatus, the teres minor, and these are all found on the posterior aspect of the scapula. What you find on the anterior aspect is the subscapularis. Now, all of these muscles play a role in the stabilization of the shoulder joint. So for now, remember that these are called the rotator cuff muscles, and you need to remember which one those are as well: the supraspinatus, infraspinatus, teres minor, and the subscapularis muscle. So when it comes to the stabilization of the shoulder joint, we mentioned a few things. So we start first of all with the bones. So that would be the scapula, the glenoid cavity, and the head of the humerus. That provides the first level of stabilization. Next would be the capsule that I mentioned, that starts from the neck of the scapula and goes all the way to the tubercles of the humerus. Then we have ligaments. So all of those very important ligaments that I mentioned before, you need to mention all of those. And that provides the third level of stabilization. The accessory features: the tendon of the long-headed biceps brachii and the glenoid labrum. And then finally, the rotator cuff muscles. So all of these are very important things that need to be mentioned if someone asks you about the stability of the shoulder joint. Okay, so that would be all for today's video. If you guys enjoyed the video, make sure to leave a like down below. And if you have any questions, you can leave them down in the comment section. And as always, I'll see you guys in the next one.